So we're going to talk about 3 patients, 3 concepts, and 1 message. The TMJ, restoring over occlusal vertical dimension, intra-oral scanning with teeth and implants, and then CAD/CAM anterior immediate provisional. Again, we're using digital technology for diagnosis. A patient comes in for a new patient treatment, for a consultation, we're digitally scanning them. We're digitally doing our radiography, we're taking our CT scans. We're doing all that digital workup of that new patient on a daily basis. Then we're going to take our impressions if we need to. We can take impressions and replace our alginates. We can take impressions and replace our PVS impressions. So we're trying to do as much as we can. We're probably about 82% digital. There's still about 18% that we're still taking our PVSs for certain situations. But we're making our restorations for teeth and implants digitally. And the abutment design is very critical. We've moved away from prefabricated abutments because now a CAD/CAM abutment is pretty cost efficient. And obviously, the anatomy is much easier to control, and the emergence profile is very important. So we can really analyze that on a quality control basis from our smartphones and be able to deliver that to the patient very conveniently. In addition to the TMJ joint, we weren't able to see that 10 years ago. And one of the big concepts that I'm going to bring today is to talk about where that joint position is on these worn dentition patients. So first off, before I start with the 3 patients, I want to just make a couple of really interesting statements about the merging of the files. This was not available until 3 years ago, where I came up to the technician and I said, guys, we're scanning, and I'd like to take these scan that we have and take our CT scan and put them together and merge them in a file that we can actually look at. We can look at it as clinicians, we can look at it as specialists, we can talk to each other if we're working with a surgeon or a different restorative dentist, and we can look at these files and analyze and saying, are we in the right position before we start placing our implants? So it became a tool for us to communicate with, and then finally, for the patient's perspective, is to show them physically what we've just discussed. Because a lot of times at the consultation visit, they hear a lot of information from us, but yet they can't really assimilate it. They can't take it home to their loved ones and make a really good financial decision. They're not really sure about exactly what we talked about. Remember, a lot of times you hear the information that gets disseminated in lecture halls, you really retain about 10%. So think about your consultation visits, and that's exactly what's happening. So we found that having a visual with the patient, having a conversation on a second consultation visit really helps them understand their treatment. And then we're going to use files like this to pre-scan, do our surgical guides, do our surgical consultation with the patient, and say, look, this is the situation that you're in. We have patients that come in all the time. They said, oh, I hear you're very progressive and you have digital, and you could do implants in a day, right? And I say, well, not in your case. You need about a 2-year bone rehabilitation for me to even put an implant in. So a lot of times they're coming for certain things that they don't understand what they have. So having these tools to be able to show them visually, digitally on a screen, on a big screen, that helps the conversation go a lot easier. Again, giving them formats like this on their treatment profile so they can visualize with their treatment plan and their financials, it just makes it a lot easier. So I think presenting it that way is very different than whatever smart things that we can possibly say to them. Again, photos like this where we can show them about implants and sinus lifts and what it all means and give them some statistics about it so they can make some logical decisions. Things like this where we scan a patient who wants implants today, and she realizes after we look at the scan, there is no bone there. Maybe replacing the bridge may be a better option for her. So again, visually for me, it's easier to talk to the patients with the actual models of themselves than try to just kind of give them information without some visual. And the whole concept of cement retain and screw retain, I hear different people talking in different ways and they're teaching in different styles, and that's great. But the reality is the patients are coming to us for the best advice for their situation. And I don't want to try to put my patients into a screw retain box. And I don't want to try to put my patients into a cementable box. What I want to try to do is analyze the situation, analyze the bone detail from the CT scan, talk to the patient, find out their concerns. Is it quality? Is it aesthetics? Is it long-term function? Is it financial that they're trying to keep it more cost-effective? And then make the right decision of the right system to use and the right access or the right cement retain restoration. So I'm from the philosophy of here's what you're giving me, this is what you have. Let's make it the best for that patient. And both work very well. It's been documented for many years. So my philosophy is trying to get the best situation for each patient. So digital impressions have been around since 2000. with the original digital scans. The new high-quality digital scans, maybe about 7 years old. We've had 4 of them. We have the Trios, we have the Steric, we have E4D, we have the 3M or iOS intra-oral scan. They all are great scanners. So the first and foremost question I get is, which is the best scanner?